You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Welcome to another episode of Pharmacy, IT, and Me. And as with every episode, we start off this one stating that the intended audience is everybody. And today we'll be speaking with our special guest and my actual classmate from pharmacy school is Dr. Jason Lebowitz on what his role is in the pharmacy technology and informatics and actually sales world. So thank you so much again for taking some time to be on the podcast, Jason. How are you doing today?
Hi, Tony. I'm doing great. Thanks for having me.
Yeah, of course. I guess for the listeners, can you tell them a little bit about yourself and, just where you are today and how you got there?
Yeah, happy to do that. As Tony, as you mentioned, it's been some years since we graduated, completed our PharmDs from USC. And since completing that pharmacy education, I've done a few different things from management consulting to software sales to now supporting my company's medical affairs team as a medical science liaison, interacting with clinicians in the field. So I've been a field-based employee for the past 5 years. And today supporting the diabetes care and digital health business for Becton Dickinson, or BD.
Awesome. So BD is a big health company that's also very involved with technology. And I guess what kind of made you decide that you wanted to delve into moving towards the health IT side of things?
Yeah, well, I think it's interesting to see the evolution of healthcare over the years. And I guess the decision to go into IT was made for me when a recruiter picked off my background on LinkedIn about 5 years ago next month. He found my background in clinical and management consulting, doing strategic marketing, developing strategy decks and launch plans for pharma companies, and working in antimicrobial stewardship a bit. This opportunity to move into a large healthcare technology company based out of San Diego called CareFusion really appealed because the technology, the software that this role was focused on was largely for antimicrobial stewardship, tracking infections, tracking resistance, and then tracking antibiotic use and resistance in the inpatient setting. And so with that role, I joined a data mining, analytics, and reporting tool with this large technology company, and I was responsible for sales in the western part of the United States.
So let's talk a little bit about your time doing sales for, antimicrobial applications. So how were you approaching that with your pharmacy background? And I guess just in a more general sense, why is it important, do you think, to have a clinical pharmacy background when you're doing tasks like what you did in sales?
Yeah, that's a great question, and almost kind of nostalgic or deja vu, pulling back to 2014 when, the company actually made a decision, taking into account the last 4 or 5 years, back to 2010, as this software had some growing pains and some challenges out there in the field. They found that the reps, what they called sales consultants, were having some trouble relating to the customer being pharmacy departments, pharmacists, directors of pharmacy, talking about infection control, infectious disease physicians and pharmacists, and being able to relate with software that tied very closely into the workflow, the clinical workflow of the departments and of the hospital operation. To have someone without a clinical background going in there and spouting off the latest, marketing messages, it wasn't the most effective, and it didn't bring value to the buyer, considering the different systems, if all that was talked about was what the one-pager and the marketing materials said. And so what the organization did was decided to realign the entire sales force to bring in folks with a clinical background to be able to have those discussions, to be able to discuss interventions, opportunities to improve medication safety, to eliminate waste in the institution, to identify infection better, and be able to support the quality improvement and safety improvement objectives of the organization. And so it's not like coming in with a widget like a needle or like a syringe, or coming in with a new, let's say, tech platform employee badge scanning. Instead, it's a very consultative approach. So you go in, you ask a lot of questions, you understand what the challenges are in the institution. Is antimicrobial resistance a challenge? Is identifying infection a challenge? Working with the staff to ensure that they wash their hands. are MRSA and C. diff and readmissions related to these infection challenges to the institution, because what you find out from that information is why the organization should be budgeting and allocating funds for your software. And so it started with a lot of questions, and again, the consultative approach required a lot of knowledge and a clinical background and a lot of listening so that you could understand what value your software was going to bring. What problems were you going to solve? Because we didn't just sell widgets. We didn't just sell software. We sold a solution. And that solution could be aligned to any number of things, depending on what the organization and depending on who your customer was.
Awesome. So I guess for your background in just being a pharmacist, were there any specific scenarios that you experienced where I guess your customer or your client showed appreciation for having that clinical background in your sales?
I mean, when you ask for specific, I could tell you a number of different scenarios where the institution had issues with staffing, with getting, having the staff in place to be able to improve let's just say the sample collection for C. diff, right? If you take too many samples when patients first admitted, and let's say they have diarrhea, but you're testing C. diff too much, you're going to have too many costs. Let's say you just wait on testing C. diff when a patient's admitted and you wait till day 3 or 4, and that's the first time someone notices the patient has diarrhea or something of that nature, and the patient has C. diff. Well, after day 3 or 4, it's defined as a hospital-acquired infection. So the differences on the quality performance of the institution are major if there's a process issue, if they should be testing before day 3. If there's an outbreak of MRSA, or let's say you're tracking infections month on month, but you're looking at the whole hospital, maybe your numbers look consistent and your numbers maybe look at X number of infections for the number of beds. But if you actually looked at each nursing unit, you'd notice that those numbers were actually fluctuating. And so being able to pick up those kinds of insights was what the software could bring. And it's not something that many people think about. It's not something that someone without a clinical background would be able to understand. But you find that when you're presenting, the terminology you use, understanding the customer when they're explaining problems, someone who is maybe a little less informed clinically might jump to the marketing material and try to turn it right back around and make promises that didn't exactly solve the problem that the infection control nurse or that the infectious disease physician were really trying to solve. So aligning those problems with the right solution, it could come in so many different ways.
Thank you for sharing that. And from my understanding, I think you told me that you are also in a program, I think at Cedars, right?
Yeah, so I'll be finishing up a master's program at Cedars. It's the first class they're graduating we're graduating in the next month or so. It's a master's project in health delivery science. And so it's health delivery science and digital health. And really what it pulls in from is it takes academic theory, which may involve applied epidemiology or health outcomes research, cost effectiveness analysis and modeling, Markov models, tornado diagrams, and understanding where maybe what a lab test or a drug should be priced at. They might call it cost sensitivity analysis to understand where the best price is for a product giving X efficacy or X safety, right? The value that product brings. Anything healthcare financing and value. We had a digital health course. And really what this academic theory pulls in is with this background, being able to take sort of a pragmatic problem-solving approach. And it requires team science, shared decision-making among diverse stakeholders, strong interpersonal communication skills. So being able to communicate effectively with different stakeholders across an organization, which a health system has professionals, highly credentialed professionals from one department to the next. So how can a multidisciplinary team become high performing when you pull in nursing and pharmacy, administration, maybe the physician group, which has maybe different financial incentives to perform, especially in today's competitive environment. And so, looking at the tools to integrate new technology and standardize them across the health system, and really pulling in the mechanics of American healthcare financing with the Affordable Care Act, and taking all of those tools to understand how to effectively evaluate, measure, and recommend new technologies. And so health delivery science is the title degree. It's a master's, an MS degree in our accredited program. And well, since I'm focused in diabetes care and digital health right now, I'll be doing my master's capstone project focusing on the available insulin titration apps out there designed to get patients with diabetes titrated up on their insulin to the appropriate dose for the appropriate insulin dose they're supposed to be on, targeting whatever their glycemic goal or A1C goal is with the provider. Because what we find is that despite clear recommendations from the American Diabetes Association that a vast majority of patients can be on insulin for years and never quite reach their A1C goal. What's nice with this program, and I kind of stumbled into this program a couple of years ago, and what I was doing when I was in my sales role is looking for ways to bring that blend of sales experience and clinical background maybe to a startup. And so I started looking at the different startups that were out there, going to digital health meetups around what they call Silicon Beach, right? Or Santa Monica, Venice area. A lot of startup activity when Snapchat IPO'd and everyone, all the millennials folks started moving to the end. They have a lot of talent. So I started being curious and trying to find maybe the next unicorn digital health startup. It was a little difficult reading through everything, but when Cedars presented itself, Cedars has an affiliation with Techstars, and Techstars is a general, incubator company where startups can go with funding and have a place to work and with venture funding and maybe limited funding go and expand. And Cedars has an exclusive healthcare partnership with Techstars, and so has about 10 startups every year in that program. And so understanding this master's program, I have the opportunity to meet and work with a number of these startups, along with the academic coursework. The curriculum just seemed like a wonderful opportunity to grow my education and keep learning after spending about 3 or 4 years in sales.
Awesome. Wow, that's a lot of experience. And I guess you're going through the master's program now and you've had experience in sales and you kind of went through a non-traditional route of getting into the health IT field. So if there was any students right now that are still in school and they're thinking of going towards that route, or maybe even other pharmacists who kind of is working a different career path now, but they want to slowly move into health IT. From your experience, do you have any advice for them?
Yeah. I think one of the things, and I met with a couple of students this past weekend at the APHA annual meeting in Seattle, and I think you could go about it a number of ways. For one, if you have it in you and you have diligence and maybe you have a computer background or a tech-friendly background, you can start learning how to code, do some basic coding. That's something I haven't done, but I'm always in awe of the folks if you follow on Medium or any of the news sources. Free Code Camp, for example, Free Code Camp, or if you go on Coursera, there's a number of different courses that are supportive for learning to code. I'd also say that if you can get in a health system or in a hospital or reach out to your informatics department. In my master's program at Cedars, we get to work with the Enterprise IS or Information Systems team and the EIS physicians and getting on projects with them or finding a job in a health system where you can start to have exposure to informatics. Tony, that's right up your alley. But as they are students, that's one path you can take from the coding and informatics exposure. What I did is I went and started applying to pharma companies. And in school, I was able to do a managed care internship, auditing PBMs on behalf of the employers that purchased the pharmacy benefits, ensuring that the pharmacy benefits were actually overseeing the formulary according to what the contract stated they should be approving or funding for the employees, pharmaceutical ones. That moved into Allergan and did some work in global strategic marketing and health outcomes research. And what that did is set me up to go into management consulting out of school. The learning curve when you go into consulting is so steep. You learn so much so fast so you can keep up and start billing out customers. That was another avenue to take. And so if you go out there and start applying to pharma, you'll find that a lot of pharma companies, which have arguably the most funding for research and innovation among anyone else in the industry, is that these companies, pharma companies, are starting to invest in digital. They're starting to invest in smarter ways to target their reps to physicians, to help the reps know their physicians better, understand what messages the physicians like to hear, to understand sentiment analysis on Twitter and on Facebook, and how the company, the pharma company, needs to brand both its drug and itself. And you might see commercials even today from the pharmaceutical manufacturers of America talking about innovation and how it comes from here. And arguably our prices for our pharmaceuticals are dramatically higher here than they are in a lot of other places. And there's, managed care dynamics, insurance landscape is very different here that drive a lot of that. But if you're still in school, you're a pharmacy student, you're looking for ways, you can reach out to folks, you can reach out to people on LinkedIn. It never hurts to introduce yourself, see someone that aligns with your work. Now, don't go and blindly ask for, job recommendations or career counseling or things like that from random people on LinkedIn. But if you've taken some initiative, maybe you've focused one of your school projects in an area that you've been curious about. Maybe you've gotten a 6-week rotation, a pharmacy rotation, or if you're in a public health program or you're in some sort of school program, you've gone out and done some research. Maybe you've published in the area. Because there's plenty of resources available online. You can reach out to folks on LinkedIn. You can set up a brief 15, 20-minute calls, but show that person that you're really interested in, that you're not going to be wasting their time. And so, you might talk to a dozen counselors or career counselors and folks, and they'll tell you, well, I'm not going to tell you what to do. That's your choice. What do you want to do? And so the only way you're going to know what you want to do is to get involved. I was always involved in school. I always implored my classmates to be involved with me, to go to industry association meetings, to, ISPOR, the International Society for Pharmacoeconomic Outcomes and Research, ISPOR. You go to these things, AMCP, and you see what's out there. You learn, and you see what it's like to work at those jobs. You don't believe after 3 or 4 years of graduating how many people add you on LinkedIn after you're in the working world, because they want to know what you're doing. And what they're doing, maybe working in a retail setting, isn't pushing their limits of what they feel they can do, and they want to do more. So as a student, you have the chance to learn as much as you can about the jobs that exist out there. And there's been a couple other podcasts, like Komal Patel's podcast and other folks you've had on here that have said very similar things, that you really have to be open-minded and put yourself out there, conquer your fear to do that, and reach out to your school support staff as well if you have issues or if you find that to be a struggle. I also tell people, if you think you want to do a residency, I fully support that. I didn't do one, but the clinical experience you get from doing a residency and spending a little more time as a practicing licensed pharmacist is invaluable, even if you want to go into industry.
Awesome. That was really good advice. Thank you for that. And, speaking about, how people can reach other people on LinkedIn and things, do you have a way that people can reach you if they had any questions for maybe career advice or, just even trying to figure out what your day-to-day is? I just want to speak with you a little bit more.
Yeah. Well, you can put a link to my LinkedIn, probably the easiest way. You don't have to send me an essay. In fact, when you're reaching out to someone for the first time, usually it's better for them to be quick and to the point. You want a career advice, point out what you've done and why that contributes to what makes you excited to move to the next step in your career, or what you want to learn from me. An informational interview, it shouldn't just be asking for an informational interview. You should explain why you're excited about it or what specifically you would want to talk about. So I get all the notifications, and, unless they're just a blind ad and someone like a financial advisor or an accountant or someone trying to get my business, if you're looking for advice or guidance, feel free to shoot me an ad, shoot me a quick note on LinkedIn.
Awesome. Thank you. I'll be putting a link to your LinkedIn in our show notes so that if anyone's interested, they could reach out to you. But, to be respectful of your time, I'd like to thank you again for taking some time out of your day to be on the show.
I'm glad I could be here, Tony. It was good sharing a little more about my background.
Yeah, and also good catching up with you again.
Anytime, Tony.
All right. If you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme or Instagram at PharmacyInformatics, or you can email me at tony@pharmacyitme.com. But, thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is a tool, patient care is the goal.